Boy, that tropical storm Arthur, outer bands must be here because man, it is windy as hell out here. All right, y'all. This article comes from the Washington Post, May 17th, 2020. As coronavirus testing expands, a new problem arises. Not enough people to test. 4 months into the US coronavirus outbreak, tests for the virus finally are becoming widely available, a crucial step towards lifting stay at home orders and safely returning to normal life. But while many states no longer report crippling supply shortages, a new problem has emerged: too few people lining up to get tested. A Washington Post survey of governors' offices and state health departments found at least a dozen of states where testing capacity outstrips the supply of patients. Many have scrambled to make testing more convenient, especially for vulnerable communities, by setting up pop up sites and developing apps that help assess symptoms, find free test sites, and deliver quick results. But the numbers, while rising, are well short of capacity and far short of targets set by independent experts. Utah, for example, is conducting about 3,500 tests a day, a little more than a third of its 9,000 test capacity, which is their maximum. And health officials have erected highway billboards begging drivers to get tested for COVID-19. Why aren't people showing up? Well, that's the $1 million question, said Utah Health Department spokesman. It could be simply that people don't want to be tested. It could be that people feel they don't need to be tested. It could be that people are so mildly symptomatic that they're just not concerned that having a positive lab result would actually change their course in any meaningful way. Well, one thing you left out is many people don't trust the medical industry in this country at all, and got every reason to feel that way. Experts say several factors may be preventing people from seeking tests, including a lingering sense of scarcity, a lack of access in rural and underserved communities, concerns about cost, skepticism about testing operations. We know there's a lack of trust in the African American community, bingo, with the medical profession, said Alla Stanford, a pediatric surgeon in Philadelphia who started a group to provide free testing in low income and minority communities, which have been hit particularly hard by the virus. The effort, which offers testing in church parking lots, really, has served more than 3,000 people in recent weeks. You've got to meet people where they are, Stanford said. Another major hurdle: lingering confusion about who qualifies. In the earliest days of the outbreak, Americans were told that only the sickest and most vulnerable should get tested while others should stay home. Now, there have been in the news over the past few weeks several Black people that tried to get tested and they were denied testing and ended up dying. So that's a problem in itself that's not even being addressed in this article. Okay. Some states have relaxed their testing criteria dramatically. Georgia Governor Brian Kemp has encouraged all Georgians, even if they are not experiencing symptoms, to schedule an appointment. In Oklahoma, Governor Kevin Stitt urged residents earlier this month to call 211 and find a location close to you, even if you don't have symptoms and you're just curious. Elsewhere, officials scarred by shortages have been hesitant to follow suit. A lot of states put in very, very restrictive testing policies, but they didn't have any tests. And they've either not relaxed those or the word is not getting out. Well, there's many ways they can get the word out if they really want to. I mean, at least one thing you got is the mainstream news. I'm sure they're not going to deny you if you want to get the word out. We want to be at a point where everybody who has mild symptoms is tested. That is critical. That is still not happening in a lot of places. According to the COVID tracking project, the nation is currently testing about 330,000 people a day, a rate that, if sustained, would cover about 3% of the population a month. That's double last month's average, achieving a goal set by the White House, but still falls short of the number most independent analysts say will be needed to avoid another wave of death and illness in the months ahead. Well, I don't think you're going to be able to avoid that anyway, not with all these impatient people in the country. Now, they're saying the United States should be testing at least 900,000 people per day, or 8% of the population per month. At that rate, they said local officials would get a clear sense of the spread of the virus and would be able to detect clusters of infection in the early stages, and could move to isolate people who test positive or have been exposed, a process known as contact tracing. The White House estimate obtained by the Post shows the nation has sufficient lab capacity to process at least 400,000 tests per day and potentially many more. But in surveys the states, the Post found that few are testing at full capacity. In 20 states that provide detailed information, the number of tests performed was roughly 235,000 per day, lower than their technical capacity, with the biggest gaps in California and New Jersey. Lab capacity remains untapped for many reasons, including lingering supply shortages. While most states say they are now able to test people in hospitals, nursing homes, prisons, and other frontline settings, many continue to be hampered by the lack of personal protective equipment, PPE, nasal swabs, and reagents, the chemical necessary to process tests. California, for example, has sufficient lab capacity to conduct nearly 100,000 tests a day, but is averaging fewer than 40,000. At a news conference last week, Gavin Newsom cited continuing supply chain constraints. And in Chicago, a major chain of urgent care clinics temporarily halted mobile testing last week when it ran out of test kits. We are currently unable to test for COVID-19 in Illinois, said a message posted Sunday on a website of Physicians Immediate Care, adding that the chain hopes to resume testing Monday as the state tries to encourage people to return to normal life, ramp up testing. Experts worry that widespread shortages could return. Right now, in some locations in this country, they don't have adequate testing to test all symptomatic patients. A board member of the Infectious Disease Society of America and vice chair in the Department of Medicine at Alpert Medical School of Brown University. So when you open up and you start testing people that are asymptomatic, you're going to put a lot of pressure on the supply chain. The federal government is working to remedy the problem, including by investing 75.5 million through the Defense Production Act to increase swab production. The Food and Drug Administration has eased regulations to permit use of swabs made from polyester in addition to nylon and foam. And the Trump administration has pledged to supply 12.9 million swabs directly to states this month, a promise many governors are banking on. Last week, Trump announced that the federal government will distribute $11 billion to help states get additional supplies, part of the $25 billion testing budget approved by Congress. All right. Still, even that supply has outstripped demand, with only about 1,000 DC residents seeking tests each day. In late April, the city expanded its guidelines to permit grocery store clerks and other critical workers to get tested regardless of whether they have symptoms. Further changes prioritize people over 65 and with underlying conditions. Meanwhile, former First Lady Michelle Obama has urged people in robocalls to take advantage of the free service. Testing has been similarly slow to ramp up in Virginia, where guidelines posted on the state's website limited testing mostly to people with symptoms who were hospitalized, living. Okay, let me just go up here. After being criticized for low testing rates, Virginia officials posted relaxed guidelines on May 5th. All right. We've said from the very beginning that we need more PPE. We have that now. Then we said we needed more testing supplies. We have that now, said former Virginia Health Commissioner Karen Remley, who co-direct a testing task force appointed by Governor Ralph Northam. Now we're working on education and bringing people to the table. All right. So look like they're trying to step up testing, but the problem is not too many people are showing up for testing. But see, here's the thing I think they should do. It's too confusing. This state will allow anybody to test, this one won't. This state has all these restrictions, this one don't. Why don't you just have uniform policies across the country, everybody on the same page? Regardless of where you are, people can get tested if that's what they want to do, and leave the option open. But, I think they mess up with all the restrictions, but we know, again, the tests are not foolproof. There's a lot of false positives and false negatives, and they still haven't worked that out at all. But y'all, please tell me what you think about. Now they have testing sites and people are just not showing up. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.